My goodness. Look at this mess. Damn.
Welcome to our exploration of Audicor, what we're calling the Holter Plus monitoring modality. We're going to look at how this new technology is basically putting long-term heart management on steroids by adding a whole new acoustic dimension to how we track heart health. It's a huge upgrade and is designed to solve a lot of the old frustrations. You know, for decades, cardiology has really relied on watching the heart's electrical signals. It's kind of like watching a silent movie. You get the plot, but you're missing a huge piece of the story. So the big question Audicor asks is this: what happens when we finally add the soundtrack? Let's find out. So to really get why this is such a big deal, we first have to talk about the challenges with the way we've been doing things. The Holter monitor is, the workhorse for finding arrhythmias, but man, it comes with some serious irritants that can make getting a clear diagnosis, well, a real headache.
For more than half a century, the Holter monitor has been the go-to. It's been absolutely fundamental for catching those tricky on-again, off-again heart rhythm issues that you'd almost certainly miss with a quick ECG in the clinic.
But, and this is a big but, here's the catch. The very thing that makes the Holter so useful, the fact that it records while you're living your life, is also its greatest weakness. All that movement, all that activity, it creates a ton of electrical noise. We call them artifacts, and they can seriously cloud the picture.
And what's really wild is how totally normal, everyday things can look like serious cardiac events on a trace. Look at this. Just shivering or being tense can mimic atrial fibrillation. A single electrode or lead that gets a little loose from sweat can look like your heart has stopped. It's a massive, massive challenge for clinicians to tell the difference between a real problem and just noise.
And the fallout from all this noisy data is huge. We're talking false positive alarms that freak patients out, which can lead to misdiagnoses. Sometimes real, dangerous events get completely buried in the noise. It means more anxiety, more costly repeat tests, and honestly, just hours and hours of a technician's time trying to manually clean up the data.
So the solution is to add another layer of information. And this is where acoustic cardiography steps in. It's time to finally turn that silent movie of the heart's electricity into a full-on feature film with a rich, detailed soundtrack.
So what is acoustic cardiography? At its heart, it's a beautifully simple concept. It records the standard ECG, just like always, but at the exact same time, it uses incredibly sensitive sensors to listen to the actual physical sounds the heart is making, the thump of the valves, the vibration of the chambers.
And this is the key difference right here. A traditional Holter only shows you the heart's electrical system. Acoustic cardiography shows you the electrical system plus what the engine is actually doing. You get both the electrical command and the mechanical response. It's a much, much more complete picture of what's going on.
Okay, so the very first big win from adding sound is that it goes straight after that problem of signal noise. When you combine the audio with the ECG, you just get cleaner data. And cleaner data means clearer answers.
This is where a device like the Audicor C300 really shines. It uses that sound signal as a kind of truth detector. So let's say the ECG shows a bunch of chaotic electrical signals. If the acoustic sensor hears a normal, steady lub-dub, the algorithm knows that chaos is just a movement artifact, not a real arrhythmia. It automates the whole process of finding and rejecting noise.
The impact of this enhanced artifact rejection is just massive. You dramatically cut down on false alarms, which means doctors can be way more confident in their diagnosis. It helps them sort out real issues from just, noise from jogging. It saves countless hours of manual review and means fewer patients have to come back for repeat studies. It's a win all around.
But here's the thing. Cleaning up the signal is only half the story. The really, really cool part is what the sound itself can tell us. This acoustic layer unlocks completely new diagnostic information that, frankly, we've been deaf to until now.
And hey, don't just take my word for it. This quote from the Journal of Cardiology Cases hits the nail on the head. There are these critical heart sounds that are just too low-pitched for a human ear to ever pick up with a stethoscope, but with the right tech, we can now hear them and even measure them over time.
A perfect example of this is the third heart sound, or S3. Think of it as a very low-frequency rumble. When that sound shows up and gets louder, it's a huge clue. It's a biomarker that tells us the pressure inside the heart is getting too high, a classic sign of a stressed-out heart and worsening heart failure.
This chart shows you exactly why this is a game changer. Our hearing basically kicks in at around 20 Hz, But as you can see, that really important S3 sound, it's often happening below 20 Hz. It is literally inaudible. You absolutely need a sensitive piece of technology to even know it's there.
So being able to detect and track these subtle, inaudible sounds is incredibly powerful. It can give doctors a heads up that a patient's heart failure is getting worse, maybe weeks before the patient even feels symptoms. That means you can intervene earlier and more effectively.
All right, let's make this really concrete. Let's talk about one of the most common arrhythmias out there, atrial fibrillation, or AFib. You're about to see just how powerful this acoustic data can be for predicting what's going to happen next.
So here's the problem we're up against. There's a procedure called cardioversion that can shock the heart back into a normal rhythm. But for a lot of people, it's a temporary fix. Check out this number. Within just 1 year, up to 80% of patients relapse right back into AFib. That's a huge number.
So for cardiologists, the million-dollar question has always been, who's going to be in that 80%? Who is going to relapse? If you knew that, you could get way more aggressive with their treatment and follow-up. But trying to predict it has been, well, nearly impossible. And this is where that S3 heart sound makes a dramatic return. A study found that if you measure a patient's S3 strength right after cardioversion, the ones with a high score had a 2.5 times greater risk of relapsing into AFib. That is an enormous predictive signal that we were completely blind to before.
So the takeaways here are pretty clear. That S3 sound isn't just noise. It is a powerful, non-invasive way to predict who's going to struggle with AFib coming back. This opens the door for truly personalized medicine, and it's teaching us a ton about how the heart's mechanical problems and its electrical problems are deeply connected.
And that right there sums up the whole paradigm shift. By adding sound, we are moving beyond just detecting something after it's already happened. We're gaining the ability to look into the future, to predict who's at risk, and to actually do something about it ahead of time.
This really does change the game for how we can assess the heart over long periods of time. So it leaves you with this amazing question. Now that we can finally see and hear the heart with this incredible new clarity, what other secrets has it been waiting to tell us all along?